This is the model of elbow joint, which is in between the lower end of the humerus and the upper end of the ulna and radius. First come to articular surfaces, which is divided into superior articular surface and inferior articular surface. Superior articular surface has these components that this one is the trochlea, shown in red color, and this one is capitulum, shown in blue color, which is the part of the humerus bone, as well as this one is coronoid fossa, just above the trochlea, and this one is radial fossa, just above the capitulum, shown in brown color, as well as this is olecranon fossa, situated on the posterior aspect. Now coming to inferior articular surface, which it has the component that this one is the trochlear notch, formed by the anterior surface of the olecranon process and superior surface of the coronoid process. This one is the trochlear notch on the medial aspect of the inferior surface, and on the lateral aspect, this one is head of the radius, shown in blue color. This articulates with the capitulum, and trochlear notch articulates with the trochlea, but in full flexion, this radial head occupy radial fossa, and trochlear notch, the part of which the coronoid process, superior surface, it articulates with, it occupy the coronoid fossa. So both these fossa, as well as in the posterior aspect, olecranon fossa, all this comes under the articular surfaces. Now coming to ligaments of the elbow joint. This one is medial side and this one is lateral side. On the medial side towards the ulna, this one is the ulnar collateral ligament, which has got three parts. This is anterior part in yellow color, in green color this one is posterior part, and in pink color this one is transverse or oblique part or band. Anterior part superiorly attached to the medial epicondyle of the humerus and inferiorly attached to the medial surface of the coronoid process of ulna. This one in green color, this one is posterior band or posterior part, superiorly attached to medial epicondyle of the humerus and inferiorly going up to the medial surface of the olecranon process. And this one is transverse part, which is extending from the medial surface of the coronoid process to the medial surface of the olecranon process. Now on the lateral side in blue color, this is radial collateral ligament, superiorly attached to the lateral epicondyle of the humerus and inferiorly attached to the annular ligament, shown in black color. And this in brown color, this is the lateral ulnar collateral ligament. This one is ulnar collateral ligament, which is situated on the medial side, but this one is situated on the lateral aspect. That's why it is known as lateral ulnar collateral ligament, which superiorly attached to the lateral epicondyle of humerus and inferiorly going up to the supinator crest. Here we can see this one is radial notch of the ulna, which articulate with the radial head in superior radioulnar joint, and just this one is the posterior margin, and posterior margin is extending downward, and this one is known as supinator crest. So this lateral ulnar collateral ligament inferiorly attached to the supinator crest. And third ligament of the elbow joint is the annular ligament, shown in black color. The posteriorly it is attached to the posterior margin of the radial notch of ulna, shown in golden color, and anteriorly going up to the anterior margin of the radial notch, like this. Now coming to type of joints. This one is humero-ulnar part of the elbow joint, which is a hinge variety of synovial joint, shown in red color. And these two forms the humero-radial part of the elbow joint, formed between the capitulum of the humerus and the radial head, shown in blue color, and this is the ball and socket variety of synovial joint. These two joint forms the elbow joint. But elbow joint complex, if someone asks elbow joint complex, then it will comprise of three joint, that is the humero-ulnar, humero-radial and superior radioulnar joint, which is in between the radial notch of ulna, shown in golden color, and the radial circumference of the head. The circumference of the radial head, shown in golden color. These two form the superior radioulnar joint, which is a pivot variety of synovial joint. Now coming to fibrous capsule, which is superiorly attached to the upper margin of the radial fossa on the lateral side and upper margin of the coronoid fossa on the medial side, and along the trochlea, that means around the articular surface, and behind along the margin of the olecranon fossa, and inferiorly along the trochlear notch and along the articular circumference of the radial head. The superior radioulnar joint shares same fibrous capsule as that of elbow joint. Now coming to synovial sheath, which lies within the fibrous capsule, and superior radioulnar joint also share same synovial sac. Now coming to the ligaments of the superior radioulnar joint, it has got two ligaments. This one is the annular ligament shown in black color, which posteriorly attached to the posterior margin of the radial notch shown in golden color, and this one is our annular ligament, and anteriorly attached to the anterior margin of the radial notch of ulna. And in pink color, this is the second ligament of the superior radioulnar joint, that is quadrate ligament, which is extending from the radial head going up to the inferior margin of the radial notch of ulna. If we talk about the relation of the elbow joint, anteriorly it is related to the content of the cubital fossa as well as the muscle which is passing from the elbow joint, and those muscles are which are doing the flexions, that is the biceps brachii and the brachialis muscle as well as the brachioradialis, so triple B. Okay, and posteriorly there is triceps which is doing extension. On the medial side, the muscles attached to the medial epicondyle, that is the common superficial flexors of the forearm, and on the lateral side this elbow joint is related to the common extensor, only the superficial one. Okay, and anteriorly, as I've said earlier, biceps brachii, brachialis and brachioradialis, as well as the content of cubital fossa, that is from medial to lateral, it is ambiguous, that is median nerve, then brachial artery, and then biceps tendon, and then superficial branch of the radial nerve. Movement of the elbow joint is the flexion and extension. Flexion is done by the biceps brachii, brachialis and brachioradialis, whereas the extension is done by the triceps muscle. Movement of the superior radioulnar joint is the supination and pronation. Supination is done by the supinator muscle and also in extended arm by the biceps brachii muscle, and pronation is done by the pronator teres in case of superior radioulnar joint, whereas the pronator quadratus is responsible for the pronation of the inferior radioulnar joint. So superior radioulnar joint, pronation is done by the pronator teres muscle. Blood supply is by the cubital anastomosis. Nerve supply, that nerve which is passing from here, that is on the medial side, here is the ulnar nerve, the relation of ulnar nerve. In the middle, this one is the median nerve, and from lateral aspect there is radial nerve. So all these three nerves as well as the musculocutaneous, which is supplying the biceps brachii as well as the brachialis. So according to the rule of Hilton, this all four nerves supply this elbow joint. Regarding the clinical significance, as this one is the medial epicondyle, and the inflammation of that is the medial epicondylitis, and also known as golfer's elbow. And this one is lateral epicondyle, and the inflammation of that is the lateral epicondylitis, and also known as tennis elbow. And this one is the olecranon process, and here lies one bursa, and olecranon bursitis is also known as a student's elbow. Regarding clinical significance of the superior radioulnar joint, when radial head coming out of this annular ligament known as pulled elbow. And second clinical significance is the Monteggia fracture, which is the fracture of the upper shaft of the ulna as well as radial head is coming out of annular ligament. This is known as Monteggia fracture.